What is the immune system?
Well, the immune system is part of the human body that monitors and surveils for anything abnormal going on that shouldn't be there. I think the primary role of the immune system is to recognize and eliminate infections. So the immune system gets revved up when it's exposed to certain pathogens, such as might be carried on viruses or bacteria, and help to eliminate those organisms in order to help the host survive. So without an immune system, you can't really survive for very long because opportunistic infections would set in and cause a person to die relatively quickly. So that's what we saw with the AIDS epidemic in particular, was that the HIV virus attacked the body's, an important component of the body's immune system, the T cells, and left patients very vulnerable to very unusual types of infections that would normally never cause a problem in the healthy individual host, such as pneumocystis carinii pneumonia and other types of infections. The immune system is also very important in monitoring for cancer. So the immune system develops mechanisms for recognizing cancer cells that have developed and help to eliminate them before they become a problem. So patients with compromised immune systems who have deficiencies in T cells or B cells or other components of the immune system are more predisposed to various types of cancers. So the immune system also has an important role in monitoring and recognizing cancer as well as infections.
So the immune system is our body's innate system to help fight infection, whether it's fungal infection, bacterial infection. We have antibodies that the body develops that can help fight particular infections. The immune system is the one that is the most commonly affected, as in the setting of blood cancers, as many times the acute leukemia affects all the bone marrow cells. So the myeloid cells typically are the cells that will help eventually mature into the red blood cells, white blood cells, and platelets. And that factory is what, helps the immune system build.
How does AML affect the immune system?
Well, the immune system is a complex organ, if you want, within the human body, consisting of different components, from the T cells to the neutrophils, macrophages in activating T cell immune responses. It's known, though, that acute myeloid leukemia that progresses within the bone marrow leads to immune suppression by simply reducing the number of white cells, and associated with that a low number of neutrophils, which then explains why patients get infectious complications, why they get neutropenic fevers, and so forth. So the rationale to treat AML effectively with chemotherapy and subsequent and allogeneic stem cell transplant is to prevent the immune suppression induced by the majority of leukemia cells in the bone marrow by eliminating them and replace with healthy stem cells that produce healthy neutrophils, healthy T lymphocytes, and therefore renew the immune system overall. This then is a donor-derived immune system, not your own anymore, and that's the complexity of the allogeneic stem cell transplantation, which also now the theory behind allotransplant for AML or other diseases is not necessarily to kill the last tumor cell, but induce a new immune system that allows to recognize the last tumor cell in the bone marrow or anywhere in the body. So the rationale behind transplant has completely changed over the last years with this approach and the new way of thinking about why we are doing it.